Colon cancer is a silent invader, often showing no symptoms in its early stages. As it advances, it reveals its presence with abdominal discomfort, rectal bleeding, and transformations in your stool size and shape. A sudden drop in weight, iron deficiency anemia, and jaundice might also indicate the presence of this disease. The symptoms of colon cancer are varied. They can be local, affecting your bowel habits and the colon itself, or systemic, impacting your entire body. Noticing what is normal for you is key in identifying potential changes that may signal a problem. Normal bowel movements differ from person to person. Paying attention to changes in your regular patterns is crucial. A persistent change in stool frequency, for example, constipation or unusually frequent bowel movements, could be a sign of colon cancer. The shape and color of your stool are also telltale signs. Thin or narrow stools, often compared to the shape of a ribbon or pencil, could be a signal of colon cancer. A change in stool color, like bright red or dark red blood in the stools, could indicate bleeding in the colon due to colon cancer. Moreover, a persistent feeling of needing to evacuate, even after a bowel movement, may point towards colon cancer. Symptoms of alternating diarrhea and constipation may occur due to a partial obstruction in the bowel caused by a tumor. Remember, these symptoms do not necessarily mean you have colon cancer. They could indicate another problem in the bowels, such as an infection, ulcers, or inflammation. This is why it's essential to consult with a healthcare provider if you notice any changes. To recap, colon cancer is a silent disease that can advance without showing any symptoms. The key to early detection is recognizing changes in your bowel habits, stool frequency, shape, and color. Remember, these symptoms could indicate other bowel problems, so consulting with a healthcare provider is essential. Paying attention to what's normal for you could potentially save your life. Have you ever wondered about the early warning signs of colon cancer? Today, we unravel the mystery around this silent disease and its stealthy symptoms. In our first segment, we delve into abdominal discomfort, a common symptom of colon cancer. This discomfort is often described as a dull, cramping sensation, mostly felt in the abdomen. Its exact location, however, can vary. It's important to note that such discomfort should not be dismissed, particularly by women, as it may feel similar to menstrual symptoms. Moving on to our second segment. Excessive gas and bloating can also be signs of colon cancer, even though they are often associated with dietary triggers or digestive disorders. If these symptoms are related to colon cancer, they usually appear late, caused by an obstructing tumor in the colon. Next up is nausea and vomiting. These can be symptoms of colon cancer when a tumor causes a bowel obstruction. If these symptoms are accompanied by other worrying signs, such as constipation, abdominal cramping, or abdominal distension, colon cancer could be the cause. But remember, nausea and vomiting alone, without other colon cancer symptoms, are not likely an indication of cancer. Now, let's talk about systemic symptoms of colon cancer, those that affect your whole body. Unintentional weight loss is one such symptom. The reason behind this is that tumors use the body's blood and nutrients to thrive and grow. So, if you've lost 10 or more pounds, or at least 5% of your body weight over a 6 to 12 month period without trying, it's time to reach out to your healthcare provider. Another systemic symptom is unexplained fatigue. Unlike ordinary fatigue, cancer fatigue is not usually relieved by rest or a good cup of coffee. It's a common symptom in people with more advanced cancers, like stage 4 colon cancer. Lastly, there are rare systemic symptoms, such as fever, due to an abscess formed by a tumor breaking through the intestines, air bubbles in urine if a tumor invades the bladder, and problems breathing if the colon cancer has spread to the lungs. In conclusion, colon cancer symptoms can be varied and often mimic common digestive disorders. Therefore, it's crucial to pay attention to your body and not dismiss any persistent or unusual symptoms. Remember, early detection is key in the fight against colon cancer. So, if you feel something's off, don't hesitate to talk with your healthcare provider. Your intuition could very well save your life.